You're listening to a DM podcast.
Welcome to Over the Back Fence. I'm Di Edwards.
I'm Nicola Dale, and we're buddies of nearly 4 decades. And yes, we actually do happen to share a back fence.
We do. We love parties, people, inspirational stories, and honestly, making the most out of life.
So join us as we open our hearts, share our stories, and hear from some of the most inspirational people in the world, and have a laugh along the way.
Yeah.
Enjoy. Tidy, howdy, we're back here on a Monday. And how was the weekend for you?
I had the world's best weekend.
Why?
Yeah, well, why rhymes with wine.
Why wine?
When you go to the Hunter Valley, and for our international listeners, that's a fabulous. It's
so beautiful.
They grow some of the most wonderful wines there, and we went to see
James Taylor. He's great.
It shows your age, I think.
How sweet it is to be loved by you.
How sweet it is to be loved by you.
Now you've got me into singing now.
Oh, no, it was incredible. And it was like beautiful glowing apricot sunset, and all the grapes going around you. And it was in Badgen.
Yes, yeah.
And it's a very small one. So it's a small event, not big, with 1,000 people, and that made it far more intimate. He came on, he was a little bit nervous at first, and I was like, 76, the voice. No, the second song, he was just jiving.
You know what, that's what I love. Talk about with ageing. He's in his 70s, and he's still sort of like rocking it, and still can get the little bit of nerves, and I think that's really cool.
That's what the podcast is about.
Enthusiastic, and it is what the podcast is about.
And you say, just go for it.
Just go for it.
Live for the moment.
Yeah.
What is it? Love what you do.
Yeah, do what you love, love what you do.
Do what you love what you do.
And we certainly do. And I talk about this, I'm loving what I do even more, because today we have got, let me introduce you to Dr. Ginni Mansberg, who is a GP who specialises in women's health and in menopause. She's a TV presenter. She's seen on Sunrise, The Morning Show, been on the show Embarrassing Bodies Down Under, a mum of 6, blended family, done so many books, and now her latest revised book is The M Word, which we just devoured. We loved it. So welcome to the Back Fence, Ginny.
Welcome,
Thanks
Ginny.
for having me.
Yeah. I love the way you were listening to that intro. You were like, wow.
Yeah, I'm pretty impressed with
Thanks,
myself.
Taylor.
That is you, babe.
Yes.
So, there's so many avenues of how we could start the interview. But I just thought, I want to go back to uni. I really want to know, did you learn about menopause becoming a GP, becoming a doctor?
Not for 1 minute.
Wowza. Not a thing.
Not one page in one textbook ever. Not one part of any lecture ever.
That's remarkable.
We're talking about a complete donut there. Nothing.
Yes. Wow. And has that changed now? Like uni students now are doing medicine. Do you know that with a curricula that all of a sudden they are doing more with women's health? And
My students are.
Yeah,
I teach medical students.
Yes,
Poor things get drowned in menopause.
I bet.
Wonderful.
But I still think it's not a lot. I think it's still very much perceived to be a marginal issue, almost like your Botox of health. Like it's sort of the health issue you're having when you're not having a health issue.
Gotcha.
Although anyone who's been through it knows that is completely not true. And statistically, given the increase in your risk of so many diseases, and the worse your menopause experience, the worse your risk, for example, of heart disease, we know we should be taking it seriously, only we don't. And so it's still not really very well taught.
Wow.
Isn't that remarkable?
It is remarkable, but I hope things are changing because we've certainly become a bit more aware of it. And I guess, because we're at this age and stage of our life as well.
Yeah.
But we saw you and we thought you were brilliant at South by Southwest.
Yes.
And they had a whole session there. I don't know if any of the listeners had gone as well, but you were talking, it was on menopause, and you were there with what I think was Naomi Watts and Mia Friedman and Alison Daddo, and it was a wonderful panel. And in the audience where Di and I sat, there was quite a few blokes. And it was a sellout. It was completely full, and it was so engaging. And so is that a change now that you're sort of seeing now more men even getting interested and listening to stuff about menopause?
Particularly their wives.
Yeah, I think their wives, and I think it's become a workplace issue. So I think, some people have been dragged kicking and screaming. But actually, I found the blokes in the workplaces that I work for, and I've got a company now called Don't Sweat It, and we provide menopause education in workplaces. the blokes are super keen.
Yeah.
It's actually been amazing to watch them. In fact, we do quite a lot of work with one of the big 4 banks, and we are about to next week do our first ever session just for men. It's an exclusive for men to learn about it at the request of the bank.
How
which
cool
quite
is
amazing.
that? That's
and you know
progression,
what? A
isn't it?
couple of years ago, I remember chatting to a barrister who was about to speak to the jury, and she had this massive hot flush. Her face was almost purple red, and she thought, maybe they're not believing. They think I'm turning porkies because I've gone bright red.
right,
And for the
yes.
first time, I thought how that comes into play and affects your career. I mean, there is 50 different symptoms. Am I right?
Absolutely. When I started doing work in menopause, which is a while ago now, there were 7 symptoms, and the one that we all knew about was hot flushes, right? And so I don't know about you guys, but I had this sort of stereotype in my head that this was something that happened to like an old lady with white hair.
Yes.
Totally.
Maybe she had a cardigan, took the cardigan
with a
off.
frame. Yeah.
Yes, fanned herself, maybe fanned the pearls as well. But that was in my head, was that she had a hot flush and then she kept being old and quiet. But it turns out that this is happening to young hot women in their 40s and 50s.
Yes, that's
And
right.
they're at the peak of their careers. And menopause symptoms directly, it seems, contributes to about 10% of women leaving the workforce at this time. Now, not many of us can afford to go into retirement at like 48 or 49, but there will be women, so about 60% of them do eventually go back and find another job, albeit at often a much lower level at lower pay, costing themselves in superannuation, in terms of income. 40% will remain retired, which is just devastating. And a lot of them have hit this confidence cliff. Like they really feel, I used to be able to do this job. I can't do it anymore. My brain is not there. I can't remember anything. I can't think as highly as I used to. My joints are aching, whatever physical part of a job she had, I can't do it anymore. And they retire, which is like, it's devastating. An additional 14% will go part-time or ask to reduce their hours. And an additional, on top of all of that, 8% will either decline a promotion that's offered to them or even ask for a demotion but stay in the same workplace. And of those who stay, 80% say that their productivity goes down.
But
So
are they
you've got
blaming
this group-
menopause? Are they saying because
Directly.
of? So
Directly.
what I'm saying are the symptoms acknowledged as menopause are, oh, look, I've got insomnia, I can't keep going.
So these women often are attributing it directly to menopause, but in fact, the work has been done by the Fawcett Society in the United Kingdom. So a lot of the women, particularly with mental health stuff, don't actually directly attribute it to what's happening around their hormone changes, but it's definitely attributable to menopause. And when you think about that, these are the women with enormous corporate knowledge. They are
Top of their
enormous
game, really, with all the
and
wisdom.
they're leaders in their organisations, they're mentors to other people, and they're just losing it. So that's just really sad. And we know about superannuation gap that happens in this country between men and women. And there's probably, not all of it can be attributed to childbirth.
No.
Not all of it at all.
I mean, who designed a woman's body? We are the most remarkable mammal, let's be honest. We actually grow a human being. But after 50, we forgot to design that bit. What the hell? I get
We're
so
meant to be
angry.
dead, right?
Yeah,
I mean,
exactly.
Brave women didn't get to menopause.
Yeah,
you know?
yes.
That's it. We're living longer,
Well, that's it.
So is the answer HRT?
Look, it's not going to be, and it can't be for everybody, because there will be women who choose not to. And I am so impassioned about women having choices. And you've got to give women choices as long as they are informed choices. If you don't want to take HRT, again, that's fine. But I think you need access to information that tells you about the pros and the cons. I would also say that some women don't have a bad menopause experience, and they don't need to take anything.
Hey,
That's
two of
totally
us.
fine.
Do you know
Both of
what?
us.
We've got to
We
say,
had
we sort
nothing.
of sailed
No.
through it, except
did.
for, I got to say, I actually didn't. I thought I did because I didn't have the hot flushes, whatever, and they go, check under the hood, and mine was bone. I actually had a hip replacement
Yes,
last year.
true.
And I've had and so I actually now have got a question, because
Yeah.
I've just turned 60, and is it too late for me to start HRT now at the age of 60? Because I know when I was reading all your book there, I was thinking I'm actually a candidate because I do have, my bone density isn't good. And I think in other areas it could probably improve. And is it too late for me? Because I sailed through, I didn't
Yeah.
get the hot flushes, I didn't get
Is
the
it
body
ever
thing.
too late?
Or what would you recommend?
The studies show that if you take HRT within 10 years of going through menopause, so 11 years of having a period,
Yes.
the benefits probably outweigh the risks in terms of reduction of cardiovascular risk, dementia, osteoporosis, fracture, and bowel cancer. They're probably, plus some people will report that they sleep better and that sort of thing. And if you add in symptom reduction, then you might weight the scales much better in terms of your HRT. But I have many women who were told that they were not eligible for HRT when they went into menopause at 49 and now come to see me at 60. And here's what we can tell you. What we know is that your arteries are kept quite pristine by the presence of estrogen. But something happens when you withdraw estrogen. Your cholesterol often shoots up quite rapidly, and you often get calcification of the major arteries in the body, including the ones that supply your brain and the ones that supply your heart. It seems from major studies that reintroducing estrogen, definitely at the 10-year mark, but possibly as early as the 6-year mark, can actually reverse the course of the estrogen from being a protector to accelerant of that atherosclerosis. And so it all depends on the amount of time you have been without estrogen in your body.
Wow.
A lot of my patients, we just go through this in detail because they were put on something, 3 years ago. They went on it for a year, then they stopped. That all counts. It's just what we don't like is to see a body that has had no estrogen at all for 10 years. And between 6 and 10 years, you've got a decision to make, because some studies show that even at that point, the risks might outweigh the benefits.
Wow. That's interesting. Well, I was kind of late, so my menopause probably didn't start till I was my nearly mid-50s. So I was kind of on the later scale of things there, so maybe I'm still a target that I can actually go for the HRT.
Yeah, and I think what's really interesting about that is that with bones, what we know is that going on HRT gives you some pretty long-lived benefits on your bones. So with the medications that are specifically for osteoporosis, in Australia, they're really expensive unless you can access them on the PBS. Mm-hmm. And in order to access them, you need to have established osteoporosis, so not osteopenia, the stage before osteoporosis, established osteoporosis, plus be over 70, or have established osteoporosis, plus an osteoporosis-related fracture.
Wow. So how expensive are we talking? Because that's a fact that a lot of people then just going to dismiss it if it's too expensive.
So it's about $1,000 a year.
Okay.
And with that $1,000 a year, the minute you stop it, or even if you're a little bit late to take the medication, so it's either weekly, monthly, 6 monthly, yearly, there are some different options, but if you're a little bit late, your bone health unwinds quite rapidly. Estrogen replacement therapy actually is as effective, but you can have it for osteopenia, not just osteoporosis.
Right.
And it gives you protection for what looks like up to 3 years after you stop taking it in terms of your bones.
Fascinating.
So that is
so interesting to hear this because a lot of people like
great.
Di and I thought, we had no symptoms at all. Like Di sailed through it. But in fact, mine really would have been a symptom of menopause because mine just deteriorated. And I was thinking, I was really surprised because I'm pretty fit, I'm pretty healthy.
Yeah, but
I have a fair bit of calcium, like my cheese and ice cream. Yeah. And, but there you go. But I'm so happy, and I'm going to see if I can sneakily make an appointment with Dr. Ginni at some stage.
Why not? Absolutely.
Or you put me through to sort of somebody else. And that's a question too. Who do people go and see, like our listeners? It's pretty hard sometimes, people who specialise just in this.
It is really hard. And when I first started in this space, I had people reaching out to me all the time on social media with tales of woe from their local GP. I think the education in this space has been much better, and your local GPs are getting so much better at this. But if you wanted to see somebody who specifically had an interest in menopause, you can go to menopause.org.au, which is the Australasian Menopause Society. So for anyone in Australia and New Zealand, you can scroll down to the Find a Doctor page, and you can type in your postcode or even search by state, and you can find the doctor near you who will actually have an interest in menopause. But not only that, you know how Medicare does not allow a rebate for telehealth consults unless it's with your own GP. You need to have seen that GP within the last 12 months. That's not the case with menopause. So there's actually a rebate that you can access, and it's higher for rural and remote Australians to actually access telehealth.
Hallelujah.
And there are telehealth specific menopause specialists in Australia who are unbelievable. Like they do much higher level training, because Australasian Menopause Society, if you have an interest, you can join. There's no kind of gate. Whereas a lot of the telehealth services, they really put their doctors through extremely rigorous training, and they allocate an hour per consultation, which is much better than you're going to get most. And then you don't need to continue to see that doctor. That can just be for an in-out, get an opinion. They'll do a really, really deep dive. I can't spend less than 45 minutes with a patient if I see them.
And fair enough too.
Exactly.
Thank you for that advice.
Well, thank you.
And we really appreciate that advice, Dr. Ginni. Just something we were just quickly chatting about prior to going on air is the big taboo subject, sex. Sex.
Taboo?
Well,
favourite subject?
Well, it is, but like it's so, you can't talk about that, or that's what are you talking about, or you feel uncomfortable sort of talking about it. And I'm like, I think I grew up a Catholic, and it was like, don't mention that word. And now it's like in 2024, I'm finding that it's a little bit more acceptable to listen to it, speak it, hear girlfriends chat about it, whatever. But I was reading in your book that, going through menopause, sex can sometimes feel like making love to a sandpaper-covered sex toy. You can feel raw and torn inside. And, I read this and I thought, this is so sad and so unfair.
Yeah, the statistics are not great. By age 65, 60% of women have what we used to call vaginal atrophy, which is just a horrible word. So we now call it the genitourinary syndrome of menopause, which acknowledges that the bladder and the vagina are actually part of, a very similar system. And sex is uncomfortable. And what we know is, unlike hot flushes, where for 4 out of 5 women, once you get through it, you'll never have one again, right? It's gone. And if you never had them, you don't have anything to worry about. On the flip side of that, the vagina will continue to get drier and smaller and tear more easily year on year. And if we don't do something about it, it will become a no-go zone. It will simply be impossible to use it. And it's very hard. Like most of my patients tell me that their libido has sailed, that ship has sailed. And often that's just part of being in a long-term relationship, right? The best thing for you to turbocharge your libido is to get a new relationship.
We're both single, Dr.
Right.
Ginni, so
and we're as happy as.
Yeah.
No,
Yes.
but I guess my point I'm trying to make is what sort of things what's ways around that? There's got to be.
So I would strongly recommend at least being open to the possibility that is what is going on. And it's hard to admit. Some women just put it down to low libido, but if sex is uncomfortable, and by the way, the blokes we're screwing at the moment, let's be honest, they think it's all about us, and their penises don't fill up with as much blood as they used to. They're a little bit small.
Yeah.
They don't ejaculate as quickly. They used to struggle to sort of keep it all in their shorts for 2 minutes. Now it's like going on for 15 minutes, and you're like, really? Can we just?
I
don't
love
need
that.
this.
It's a bit of
This is just
reversal,
not-
isn't it? Yeah.
I'm not interested in this 15-minute situation. But I think that's, unfortunately, having a red raw vagina and all you've got is a bit of KY jelly, that's not going to cut it for the 15 minutes of the sandpaper-covered battering ram. That's just not going to work at all. So what I would recommend is that you at least discuss some vaginal estrogen, which is, oh my goodness, I love that stuff.
Okay, so that's a cream.
Would you get that prescribed by a
something.
doctor?
It has to be,
Right.
yeah. So we would prescribe that it comes in Australia as a cream, and then there are 2 pessaries, a sort of bigger one at higher dose, which I'm not going to lie, it's a lot. Like when you go to bed and you put it in at night, wear your undies, wear a pad. It's all going to happen overnight. There's a lot happening. There's one that's a bit smaller, lower dose. I normally give my patients an option, and I often start with a higher dose one just to sort of, I guess, do a quick reno.
Kickstarter.
Get
Renault
the
engine.
A Renault, that's great.
Yeah,
And
we're
then
ready
you
to
can-
go.
And then we can switch you. I personally don't love the cream because unless you've got the world's shortest nails, it sort of gets in your fingernails and you're like, well, where do I put all this? And you pull your finger
and they
out
start
and
growing.
Oh my God.
And how long does it last for?
Yeah.
Like, when you insert it, I guess, and then how long does it sort of like last?
And how often do you have to take it?
How long do you have a lubricated vagina?
So as long as you keep using it.
Okay.
So once you don't need it and you're ready to retire that part of your body, then stop using it. But it's fairly quickly absorbed. The actual estrogen is fairly quickly absorbed. So we tend to tell you to put it in overnight, more for, gravity reasons so it doesn't fall out. But, we tend to say put it in overnight and within a few hours it's absorbed. That is really important for any penis that is going to come in contact with the estrogen. Most men don't like to have a penis cover in estrogen. I don't blame them. It's not probably what you'd want for them. And similarly, any ejaculate that's going to go in there is going to quite dilute the estrogen that you put in and make it less effective. So unfortunately, the nights that it's in, either have sex early and so that all that's out and that you can then put it in later, or the other way around. If you're having a nice long afternoon nap, you could probably shove it in then and then have sex at night, that sort of thing. But otherwise, sex and vaginal estrogen don't really
that's
mix
good to know. Is it expensive as well? Like, you're sort of saying, the other...
It is. It is expensive.
What are we looking at?
But what's an alternative, though, to estrogen cream? Like a lubricant?
Or coconut oil, is that good? Or coconut...
Exactly.
Coconut oil is my absolute favourite lubricant for sex.
That's great.
Yeah.
It's got much longer lasting. It's very long lasting. I like it. It does not play nicely with condoms, so just got to remember that. But if you're going to use it, put it directly on the penis. I think where people go wrong with lubricants is shoving it on the vagina. That's never going to work. Just get the coconut oil, rub it in your hands till it's nice and melted, and then chuck it directly onto the penis. So that's the way to use it.
Some of them have the
That's a good
coconut
tip,
bits
isn't
in
it?
there, so you got to be careful with that
tastes
one.
quite nice, though, doesn't it,
Oh, I
Dodie?
do like a bit
It's
of
all about
coconut.
the flavour.
Rum and coconut.
That all melts quite quickly.
Yes.
Don't worry, Joe. We're all good.
Woo-hoo.
So the general sort of like, KY jelly or the stuff you buy at the supermarket is not okay, would you say?
Look, I think it's fine for a 16-year-old girl where it's all going to be over in 60 seconds. That's fine. But it's not designed, it is really designed to make a colonoscope work really well. And that's what they use. If you ever go and have a colonoscopy, it will be covered in KY jelly and it does an awesome job of getting it in there. It is not, it's a water-based product. It is not designed as a really great lubricant, despite its reputation.
Now, can we ask a little bit about you, Dr. Ginni?
Yay.
Because, you've got such an interesting, incredible life. And,
Remarkable.
and back in the day too, so you found yourself as a single mum, correct me if I'm wrong, and you had little kiddies, is that right?
Yeah.
How was that time for you? And
how is it for anyone?
yeah, was it one of the most difficult times of your life then? Or
The hardest.
Yeah.
I think women are, I think this is changing for our millennial sisters, but certainly for Gen X women and certainly for boomer women, we didn't feel comfortable even mentioning money. It was a bit uncouth and a bit gross. So I kind of got divorced not quite knowing how the credit card got paid at the end of the month. And then all of a sudden having rent and 3 sets of school fees and orthodontics and everything else to pay for. You have to learn in a hurry that like what you're capable of and what you can earn. And for some people, they fall apart. For me, it just shoved a rocket up my bum and I was just determined to earn enough money to support my baby birds. And that it actually ended up becoming an incredibly empowering experience. But there is nothing like having a panic attack when you see, the electricity bill come in.
Well, I really admire you because you've had that thing of something going a really bad experience and you've actually turned it round and it sort of became a superpower for you, and like a rocket.
You said you were consumed with guilt.
And then I love it.
And then
you've found love again. You've remarried. Now, just a quick little one because some of our listeners might know. If you can tell us a quick thing of your first date with your hubby. How was it? Did you go? Were you on the dating apps or how did it roll? Tell us about your first date.
I'm a terrible now ex-runner, but I was a terrible runner and had a running club. with his brother, and I think he
Right.
used to sort of come occasionally and make a cameo appearance and, you know, go like a lightning bolt and leave us all for dead and nothing like this. But I thought he was pretty hot. So that's how I met him. Our first date, which was an incredibly long time in coming, I was so sure that he was going to call, never call. In fact, he gave my number to a friend of his who said, "Oh, I got your number from Dan." I was like, "Great, thank you."
Yeah, well,
great.
great.
Thanks, Dan. Yeah.
Good on him.
Thank you. Yes, sure, I'll go on a date with you.
Yes, yeah.
But yeah, anyway, so on our first long-awaited date, I had all 3 kids sleeping out. My eldest was 15, and he had his first episode of the Smirnoff virus, which for the uninitiated is a little bit of
the
vodka.
law of averages.
Exactly.
Yeah.
I remember my
Yes,
son caught that once too.
Yes, once. Lucky
Yes,
you.
yeah.
Every
Maybe happened all sorts of
5:30
times.
every night.
So, yes, we didn't quite get through entree before I got the phone call from the friend.
No.
Yeah, Sam's not feeling well. Can
Yes,
you-
he's got a bug.
On your first date.
Yes, first date. And I said, okay, drop me home, because he had a really nice car. And I was like, you know, drop me home. I'll go get him. He's like, no, I'm coming with you.
Oh.
So he came with me to pick up my literally legless son, who was already covered in vomit. And then, despite my husband's outstanding ability to slam on the brakes of the car and pull him out of the car so he could vomit in the gutter, the 4th time it didn't work. And
Oh,
he threw
nice car. Not.
yeah, on his toddler seat. It just went down so well. So by the time he got me to my place, I was like, oh, this is my house, thank you. And he carried the vomit-covered Sam into his shower and
Wow.
put him in the left lateral position, as one does. And he was still vomiting down the drain of the shower, and he turned the shower on. Can I swear? I'm
Yes,
not saying
you
my-
can.
Yeah,
we love it.
podcast, baby.
My son sat up, had not been able to speak for like the last hour, and said, "Fuck off, bitch, or I'll stab you in the nuts." And again. So I said, "Daniel, this is Sam. Sam, this is Daniel."
Oh,
And
how
I
good.
thought, I am never
That's
going to see
the
this man
best
again.
story.
Look at this.
Talk
I know.
about a blended family. Because he had
And he
3.
said, "I'll come back. He's too big. Don't try and carry him into bed. I've just got to go home and have a shower. I'll be back." And I was like, "Yeah, sure, that's
Sure.
going to happen."
How
Yeah,
about
sure.
a pash?
Yeah,
Not?
Yes. But he came back.
Wow.
Wow,
Because
isn't that
he's got 3.
wonderful?
He had 3 children. You had 3.
He had
Must
3
be
years.
love.
So joined, you had 6. You've got 6 children.
We have 6, and now 2 are married. One's about to get married. We've got a beautiful
Congratulations.
boyfriend as well. Yeah, everyone. It's a growing family. It's
And
lovely.
it all worked well, blending the 2 families?
Oh, listen,
I mean, you
this
must
is
have-
not easy.
Yeah.
The
Yeah.
Brady Bunch, I guess. you know.
Seriously.
We were so, there's no Brady Bunch. There was no Alice. There was no Dan.
Yeah, exactly.
We had it easy.
Yeah, we all need an Alice, don't
Everyone
we?
needs
You
an
know,
Alice.
yeah.
You're right.
Yeah. It needs constant hard work. You've got to be able to turn the other chin. You got to not take things personally. If you have an other parent that you can work with, you are super lucky. And if you don't, you're going to have to work it out on your own.
Step
The
up.
most important thing is the marriage, I think. And then if you've got that going really solidly, then you can make everything else work.
I love hearing you say that, and I think that's really wise words of wisdom. Well,
Absolutely.
from your
But
opinion,
it's
at least there
positive.
too, it really is, because sometimes when it's all about the kids, that's when the marriage falls apart. And it's easy sometimes to take the other partner, I guess, for
Very
granted
true.
because you sort of think they're always going to be there. And, whereas if you can make that special time for yourself, and I think it's kind of good role modelling for the kids too.
Blended or not, I think, from your book in particular, the M Word, you talk a lot about how important communication is, particularly when a woman's going through menopause, how it's vital that you communicate that with your partner and vice versa. Men have their issues too, as you mentioned. Communicate it. You don't just push it away and walk away.
And communication is not just what you say, it's the questions you ask and the way you listen. So if you have genuine empathy and you really want to understand things from the other person's perspective, and you honour that and you give that space, then that makes your communication much better. A lot of people feel like, oh, I'm a really good communicator because you're really focused on what you say. You can say the same thing to 2 different people and go down like a lead balloon with one and really well with somebody else, because communication is a 2-way street. So if the love and respect and honour is there, the rest will follow. But you've got to empathy, listening, and really showing up for that person and trying to understand where they're coming from.
Yeah.
That's beautiful.
Yeah, it really
That's really
is.
beautiful, and thank you
Yeah.
for sharing that, because I think we can
Imperative.
all hear those reminders to listen and
Yeah.
to really understand and maybe repeat back what they said, that true communication.
Totally.
Because it is so easy to think, well, I've got my point across.
Yeah. I hear
whereas,
you, but it's not what I agree, but I hear you.
And
Yeah,
I think that's really a
agree.
great sort of tip. And what about, because you see women, and, we've got a lot of women listening, aging. I've just turned 60. Di's thrilled to bits because I've finally, it's the happiest day of her life. Because
Join the clan.
Never thought I'd get there. But are there any tips sort of that you've got sort of for women as we age? And, whether, I know it's a big all-rounded question, but whether it is, whether in your love life, in your personal life, in your, whether it's heartbreak or moving forward or health or, the whole holistic thing as we age for women.
So I've got 2 pieces of advice. The first thing where I see women go wrong is that they don't pay enough attention to their health, and it will sneak up on you. And once you've had a heart attack or got a diagnosis of cancer or whatever it is, not all cancer is preventable, but a very large amount is preventable. And you do have to watch what you eat, and you do have to not drink too much, and you do have to do your exercise, because this is the time you actually don't get to abuse your body anymore. You have to take it seriously, and you don't want to look back with regret, because now's the time. So that's a bit of a Debbie Downer, but
it's not.
I think that's the best warning
Debbie
about
Downer.
that. We were saying that ourselves even with drinking, because we like to have a drink. But it's funny, we actually naturally now don't like to have too much, believe it or not.
We used to.
Yeah, because I'm just listening to my body. I just don't feel like it anymore. I love a glass of wine. I love a champagne.
Yeah.
But then I'm going, I don't want to have too much more.
No.
I don't need it anyhow.
I know the
I
switch
feel
off
good tomorrow.
valve.
But I think it's our bodies, and it's listening to our bodies. I just can't take it.
And also working the way we do. It's like you want to be committed.
Yes.
That's essential.
You have to. You can't abuse your body and
We're
just
not
take
25
it for granted.
anymore.
Exactly.
You're not.
The energy.
Sadly.
I know.
The second thing that I probably have this talk with women so many times a day is that women don't have what is called now self-compassion, which sounds like such a wanky term.
No.
But what self-compassion is women are very good at being compassionate for each other. And we would never say to a friend the things that we say to ourselves. The self-hatred, loathing, you're pathetic, you're fat, that other person is successful, you're not, you're a loser. Whatever we say to ourselves is so mean. And what studies, because we've been able to show self-compassion now, the powerful impact on preventing depression, preventing dementia, preventing heart disease, that you need to refocus your lens of all that compassion that you have for your sister, for your best friend, for the person at work, and you need to direct it towards yourself. And if you've never done it before, now is the time. Your children are watching you, your friends are watching you. It is okay to not be okay. It is okay to not look like a size 6 model. It is okay to have not nailed every aspect of parenting. But we need to not be so hard on ourselves all the time. Men are not.
No.
Men are nowhere near as self-critical as women are. And if anybody was going to go and Google anything, Kristen Neff, N-E-S-S.
Yes.
Oh, we
I
love
follow
her.
her.
We love her, yes.
Fabulous.
She's
Compassion.
Yes.
Compassion.
Brilliant.
Amazing. And she has worked a lot with some really amazing dementia researchers and cardiovascular researchers in the US. So Rebecca Thurston and Julie Dumas in America, where they've done a lot of studies of like what we call intimal thickness, so how thick the insides of your arteries get. You can actually shrink the intima of your arteries and actually improve your cardiovascular health by using self-compassion.
I believe that.
That is
I strongly
bravo,
believe that.
Bravo to hear that. And we'll actually put link on our show notes because I think that's so wonderful to hear.
It's beautiful.
And I was reading in your book too about, might be sort of similar, but tell us about the ACT therapy too. Can you
I love that.
Yes, I loved it too. Can you share that, please?
So ACT is acceptance and commitment therapy. So it has kind of 2 parts. The acceptance is acceptance of what you can't control. So I think, my husband always says it's not about the hand you're dealt, but how you play the hand that you're dealt.
Right on. Mm-hmm.
You can't change the winds. You can only set your sail. Life gives you shit, and your job is now to say, what are we going to do with this? How am I going to turn it around? Because there are things I can't change. And there's a concept in psychology called the central locus of control versus the external locus of control. And that is, if you feel that your life is being controlled by nefarious things outside your control, you can't change anything and you feel like a victim all the time. Whereas if you don't focus on that stuff and you accept the things that you can't control the fact that your partner had an affair and left, or the fact that you got, I don't know, leukemia, or that your mum died before it was her time and you don't have a mum around for you anymore. Bad stuff happens and you need to accept it and not just catastrophize over it all the time because you can't fix it. So that's the acceptance part of ACT. The commitment therapy is committing to have a life of authenticity and a life that is more value filled. And by that I mean, what do you do that genuinely brings you joy and makes you feel better about yourself? Whose name pops up on your phone and you go, oh my God, yes. How do you get more of that in your life actively? You're in control of this now. What are the things you don't ever want to have back in your life again? And what are the things that you want more of? Go get them. If you are sitting there in a job that brings you no joy and no happiness and no satisfaction, or you're in a relationship for the sake of the children that brings you no joy and that keeps you being less of the person that you want to be and is keeping you unhappy, then what are you going to do about it? It doesn't mean leaving your partner, but what are you going to do to fill your life with joy? Where are the friendships you're investing? What are the hobbies you're investing in? What are the ways you're giving back to your community? Is it something simple like reducing your carbon footprint by using less electricity? Or is it something more complicated like going and signing up for a charity or doing a walk and raising money for something that you really care about and love? You have one life. Go take it by the hands and actually make sure that the life you're living is meaningful and purposeful and fills you with satisfaction and joy. That's ACT.
What an act. Is this intermission? I'm going to chop
I tell you what, Oprah, move over. We have Dr. Ginni in the house. Woo. Seriously, you are the bomb.
And you know what? she's a GP, like years ago. GP, right? Yes, there's a pill. Off you go. Goodbye. Yeah. But you know what? There's an element of mental health.
We're really proud of you. We really are as women.
So good on you. Well done,
and we
Ginni.
do need to hear voices like that. And you saying that, saying again and again and again. It is music to our ears. And I think for all our listeners there, that's sort of what we're all about. We're all going to get hit with different things, and that's just life, and and how it is. And
come out better the other side.
Are there tips along the way of trying to get yourself up? I know you sort of said, you just got to face it. You've got to have that radical acceptance there. But, when you are still stuck in that little deep hole there, and
So I do think that if menopause symptoms are the ball and chain on your life, don't feel guilt, have self-compassion. You deserve to feel better. Go and get the treatment. Don't feel like that. These symptoms are 100% treatable. You can live your absolute best life without being encumbered by perimenopausal depression, without being encumbered by aches and pains, low libido, hot flushes, dry eye, burning mouth, whatever it is that's happening for you. Go and get it sorted, and actually because you deserve to, and get the guilt out of that conversation. That's just garbage. Wow. And we've got to get you sleeping. Like if you are eating rubbish, sleeping poorly, feeling dreadful, let's get your body working for you, and let's not, throw too many whips and chains at you because you're not actually living your best life and calling, your girlfriend from year 6 primary school and saying, hey, where are you? Let's go and have a coffee. Yeah. Those things will come when you feel better. Mm-hmm. And why I work in menopause and why I love working in menopause is that often my patients will come in to see me in such a mess and have spent so much money in shit that does not work and that has exploited them, and then they feel stupid and then they feel ashamed and they just don't feel deserving of taking stuff that's actually going to work. And within 3 months, they're back. And now you got your whole rest of your life in front of you. What are you going to do with it? Because it's that good. It's that amazing. We have got that many tools that we can use to make your life amazing. And that's what I want for every woman. You might not choose to be CEO of a bank, but you might. And you should have everything open to you that you want in life. You shouldn't have your hormones dictating what you can and can't do.
And you know what self-compassion is? Number one, go and get some help. Step out.
Yes.
Yeah,
Step
it
out.
is.
Put your hand
100%.
up. Hey,
Yeah.
I need some help. That's
Yeah.
the start
and
of the
there's
process.
no shame in it anymore.
No.
And it's really good just to hear that, because it is like that self-compassion, and they're just beautiful words. And I tell you what, you're in the right profession,
Yeah.
that's for sure.
Yeah.
And I love it. And how did you get into media as well? Because I mean, doing shows like was the embarrassing
Endless.
bodies down
Oh, yeah.
under or whatever. Is it fun? Do you, I
I
mean,
did
because you
see
you
that.
seem like you're a natural, but how did you get into media, being a doctor?
So it was a very bad series of events with babysitters,
Oh.
like near-death experiences.
Love it.
Because I was trying to go the cheap route. You know, you can get the proper, like, actual nanny, the career nanny who's done the first aid certificate and, you know, has got Cert 1 or Cert 2, whatever. No, I just decided to get, like, the series of Irish backpackers who were there for 3 months and, near-death experiences.
I'll
Anyway,
train them.
I just
Trainable.
thought I need to do something from home. And so I did a journalism degree because I kind of got into medicine on my English and history marks. So kind of went and did a journalism degree.
As
This
you
sounds
do.
really
Why not?
long-winded.
That's what I mean.
Why not?
And then
multi-skilled.
an editor of a magazine that I was writing for said, you know, I've got a side hustle as a scout for a book company, a publishing company. So if you ever think of a book, and I'm like, oh my God, I've got to think of a book. I wrote this book called Why Am I So Tired? I think it might have sold 10 copies. Anyway,
I'll
But it was
read
cathartic, though.
Yeah. Why am I so
why am I
tired?
so tired?
That's good.
but it landed on the desk of, they were just creating Pacific Magazines, as it was called then,
yes.
creating Women's Health Magazine.
Yep.
They needed a doctor. It literally landed on the top of the pile of the incoming editor who went, you'll do, are you available as a doctor? I said yes. And then Pac Mags got bought by Network
Wow.
7.
Yes.
And Sunrise was like to Women's Health, hey guys, do you have a spare doctor we can use? Because the doc they were using at the moment, who I absolutely love, was an older bloke, and there were some segments that didn't quite work.
Right, yes.
And they were like, sure, have our doctor. And then I just started doing more and more and more. And I'm part of the furniture at
You
Sunrise
are.
now.
And,
you
and
are.
might I say, with 6 children at home,
You know, like
hello, like
yeah.
my God, you're dynamic.
You are dynamic.
Where do you get your energy from?
I think my mother. My mother's an Energizer bunny as well.
So you're going to say we're talking genetics here? Like, do you take vitamins? Like, do you?
She looks a picture of health.
What about that running club? Are you still doing that?
We still do.
Yay!
That's great.
There you
Yeah, so we've
go.
gone from
Exercise.
Keeps our
Tuesday,
heart
Thursday,
going.
Sunday to every Sunday. It's just a Sunday thing. My running buddies are like,
You know what,
And
Tony?
so-
How about that? We could get into a running club. I've heard that's actually a new way of
I'll be
dating.
running that way.
Have you heard of that, Dr.
No,
Ginny?
I love to walk. I'm
There's
a
a
walker.
new way of, because people are getting more healthy. They're not sort of going out and drinking or whatever. And then they actually, the running club, I saw a thing now, has become a bit of a sort of instead of swipe right or left.
Oh, well, that makes sense.
You
I
actually,
like
you
that.
can meet some nice
Yeah.
people, just like Ginny did when she
Yeah,
met
actually,
her
we're
husband
interviewing
too.
someone.
Di Westaway.
Yeah.
Well, she actually went, but I love this story too. She
Yeah.
went on the dating apps, but she was very specific, and she went on one purely. You had to be outdoors. You had to
Yeah.
be into hiking. You had to be into nutrition and fitness and that. So she
None of that
limited it
bingo
right
stuff.
down. No, and it was great. And she's found a new love.
Yeah,
and
she did.
They're hiking the highest
Like-minded.
mountains in the world and doing somersaults. And the
Fabulous.
whole
I bet
thing.
they are. We want to thank you for the book too.
Yeah,
For
absolutely.
so
We
many women
love
out there. The
this.
book is a must read for every woman over 40. It's literally life changing, Mia Friedman says, and
Yeah.
we agree 100%.
We agree. I read it.
Yeah.
I read this
Brilliant.
from front to back.
Yeah.
And I've written notes.
It's
You know,
great.
the whole thing too. And I loved it. And I
Thank
learned so
you
much
for putting
more.
that M
so
out
thank
there.
you. It really is great. And so we've got a couple of our signature questions for you. Did you want to shoot Daddy Doody
Oh, I'd
Daddy
love
Doo?
to know this one. If you had the chance of meeting anybody over the back fence, who would that be and why?
so if I literally could have anyone, living or dead, I would choose my dad because more is more time with him and I miss him like crazy. So I would just want him back.
Oh,
And
what
if
was
I
your
could-
dad's name?
What was, yeah.
Rodney.
And what was he
Rodney,
like
the
as a
best
dad?
Warm, loving. He was the person who made you feel the way you wished everybody made you feel. Like he just made you feel very loved and very special.
Well,
So
wouldn't he
that
be
was-
proud of you?
Yeah, he was, and he told me he was proud of me all the time.
Oh,
Every day.
that's so important.
That is
isn't
so
it?
important. That's beautiful. We
We
don't have our dads either,
Yeah.
and they're very big. We
We
talk
had
about them
similar dads.
Yep, and we talk about them every day.
Very
So they do
positive.
leave a good stamp,
Yeah.
and so
We do talk about them, think about them, and talk about
We do
them.
every
don't
day. Every
We
day.
mention. I go Al. That's
Yeah.
Nicholas' dad, and I go that was Al.
Yeah.
Or
Yeah.
Now I'm
something
going to say
positive.
Rodney. That's beautiful.
Yeah, Rodney's thrown into
and you
that
lost your dad.
mix.
Correct me if I'm wrong. If you're pretty young, did you when you lost your dad, or how old were you when
My
you?
dad unexpectedly lasted till he was 82,
Oh,
he
okay.
had his first heart attack at 42. He had a bypass in 1977, one
Wow.
of the first Australians ever to have a
Wow.
bypass with very early onset heart disease, which I share the genes for early onset heart disease. So that's the
Shows what you can do about it with intervention.
yeah,
That's
he was
amazing.
amazing.
Absolutely.
Wow.
And how
Now-
the operations have changed.
Now, just our final question is: what advice would you give your 20-year-old self?
Probably don't worry about it. Apply that across the board. 20-year-olds have a lot of angst, I think. And, you just worry about what people think about you. They don't. They're thinking about themselves.
Yes, they're thinking about themselves.
I would say to her, you look great. Don't worry about it. I would kill for my 20-year-old body again, but I didn't like it at the time.
Wow.
There's just
That's
a
so
lot
true.
that, I think you're always, there's just a lot of angst when you're 20. And I just say, chill, you're fine.
Yeah, and
that's beautiful,
it seems
isn't
to be
it?
run of the mill, doesn't it?
Isn't it,
With all the people we've interviewed, there's this vein of just don't worry about it.
Yeah,
Let
don't
it
worry about, and
go.
don't worry what other people
Yeah.
think.
Yes,
because we
more so.
always. I think that's one of those things that
Particularly these days with social media.
comes with a bit of
Gosh.
age and wisdom now. As we do get older, we don't care as much, do we?
No.
Well, also your
I
brains get deprogrammed because adolescent brains
yes.
are programmed to be more hyper aware of what their peers are thinking and to moderate their behavior towards that of their peers, because in caveman times they were around the time of adolescence going off to form new tribes and sort of breaking off and going off to form a new civilization. As you get older, your brain is much less charged to actually even notice what
That's
other
why you
people
don't
think.
give a
Oh,
F. Is
wait,
that
what do
it?
we say? Over
Wow.
60, we're
Well,
free.
Yeah, we are
I
free.
love it.
That's the big
Yeah.
F word, and we're big fans of that.
F it is.
Well, thank you so much for being a guest. We would absolutely
Yeah.
love to have
Thank
you
you,
on again.
Ginni.
You're just absolutely inspiring. You're positive. A really great take on menopause and women's health and men's health too. The whole
great all
well-being. It's just
round.
wonderful.
Yeah.
So thank you
Full
so much.
picture.
And everybody, thank you for
Yes,
listening. And don't
thank
forget
you.
to share, rate, and review because it really makes a difference, doesn't it,
does.
Dodie?
Well, yeah, we make a bit of effort, you make an effort,
yeah, it does.
and we're in sync.
It helps us there, so don't forget to do that. And now we always like to give some stars, and rating for 5 stars. Now, what do you think? How many for Dr. Ginni today? What do you think? It's out of
Ginni,
5,
Dr.
but I
Ginni.
think, come on.
I loved it when Ginny did 2 things when she was talking
Yes,
about
double.
suggestions for aging, and it looked like the peace sign. I thought it was beautiful. So, what about 20 out of 5?
20 out of 5. I think so. 5
That's
times
my
20,
first ever
exactly.
20 out of 5 in
Yes,
my
20
life.
out of 5.
I love
Bravo.
you.
Stay
Thank you,
positive,
everybody.
right?
Yes,
Over
stay
60.
positive. Thanks, everybody. Ciao, ciao.
Yeah,
Bye-bye.
take care.
Bye. Bye.